Well, hello, everyone. Welcome to today's training. I'm Travis Parker-Lee. I'm a senior specialist at FAB Center for Innovation. I'm very excited to be kicking us off for the next 90 minutes. Where we will learn how to become better advocates by understanding which foundational moral values resonate with us and why it's important to recognize, appreciate, and learn to speak to others' values in the communities we serve. If you want to go ahead and introduce yourself in the chat, if you've not done so already, you can just put in your name, your organization, and where you're located. I'm thrilled to introduce you to our speaker today, Dawn Hunter. She serves as the Director of Health Equity at the Network for Public Health Law, or NPHL, which is an organization that helps others identify legal and policy solutions that will significantly and positively impact the health of their communities. NPHL has been a partner with FAB for several years through our work with All-in Data for Community Health and other initiatives that we have going on. I'm going to give just a short little bio for Dawn and then put in a link to her more full experience, as you can read more about her and look at some articles that she's published. But Dawn is an experienced state health department policymaker and legislative analyst whose work focuses on research, analysis, implementation, and capacity building related to the use of law and policy to improve health outcomes and advance racial equity. She is particularly interested in the development of racial equity action plans and implementation strategies at the state and local level, and leads an ongoing assessment of declarations of racism as a public health crisis and related efforts to address health inequities. So prior joining to NPHL, Dawn served in a number of roles focused on public health policy and health equity, including serving as the Deputy State Health Officer at the New Mexico Department of Health. Some of her core responsibilities there included managing their legislative agenda and policy activities, as well as strategic planning, performance management, and public health accreditation, which we love to hear. Dawn is certified in public health by the National Board of Public Examiners. She received her MPH in global communicable disease from the University of South Florida, and she received her JD from Stetson University College of Law. I will say Dawn is located in the Tampa Bay area, so is under a hurricane currently. So hopefully internet stays on, but we'll adjust if needed. But please join me in welcoming Dawn as she gets us started. So glad to have you, Dawn.
Thank you so much for the opportunity to be here. This is one of my favorite things that I get to do, so I'm excited to share it with you today. I am in Tampa. Most of the storm I'm in the Tampa Bay area. Most of the storm has passed us. Travis will message me if I'm starting to have any video issues or anything like that. And as we get started, I want to say I will have slides on the screen. So make adjustments for your preference, of course, on how many, seeing the slides and people. There will be several, opportunities to interact in the chat. On a Jamboard, we'll have a video. And so my hope is that you will engage in those discussions in those different ways. So I just wanted to give you a heads up so you can share when those prompts come up. You can also put questions in at any time. If you want to, if something comes up and you want to talk about it, just put it in the chat and we'll make sure to get to it. Yeah, and I will get started. What can I tell you about myself? Let me think. Oh, I'm not even on the right slide. Let me get myself on the right slide first. And then I will share my screen. Okay, now I think I'm ready. All right, so hopefully you are seeing the title slide. Yes, okay. So Becoming Better Messengers is an initiative of the Network for Public Health Law. It's been around for at least about 8 years or so, and it was spearheaded in part by Jean Matthews, who was my former boss, and who had a long career at the CDC as chief legal officer, and then is one of the founding directors for the network. And I like to start out just saying, for those who are not familiar with the network, we're in the process of making some realignments, but we have historically been organized by region, which it matters in the sense of we like to have those regional relationships and relationships with folks in our states, but no matter where you contact us, we will make sure to connect you with the expertise that you are looking for. So we do research and analysis, we'll answer legal and policy questions, we consult on specific projects, we do trainings and workshops like this, and we make connections if we don't have the expertise. I like to share what our top areas, so our main thing that we do is provide legal technical assistance. So I like to share, what the kinds of questions that we get are, and these are actually in order of most requests. So most of our requests during COVID, you can imagine, were around emergency legal response. But we also get a lot of requests around substance use and harm reduction. We are home to the Harm Reduction Legal Project, which is headed up by Corey Davis. And then we have a whole team of attorneys that focus on health information data sharing. So you may have interacted with some of them at some point in time. My team falls into the adult at risk category. We're actually updating our tracking categories to be more explicit about racial health equity, which is primarily what I focus on. So I focus on racial health equity strategies. I focus on civic health and well-being, and I do this messaging work. And part of why we do the messaging work is really because we think about the 5 essential public health law services framework, and the idea, one of the pieces of that is building political will. So you can't do that if you can't explain what you're trying to do and you can't get buy-in. And so it's really important for effective law and policy that we have strong communication strategies. So let me make sure I can open the chat. How many folks are already familiar with either Moral Foundations? And before you got the email saying, go check out this video, how many of you had either done this before or read the book from Jonathan Haidt, or were familiar in any way? You can put in the chat. Yes, no. No, okay. I have to admit that I'm excited when people say no, because then this will be really, hopefully very exciting for you. And I see, Caroline, you have done it before. So hopefully some of this might be new. We've done some refreshing our material. Okay. So the first place I like to start is thinking about messaging framework. So what is it becoming better messengers versus any other thing? So our workshop really focuses on how we create the capacity and build the capacity to actually be deliverers of messages, as opposed to spending time making the messages themselves. So we get the question all the time, as do our partners, is tell me what to say. Well, we're not going to tell you what to say. We're going to give you the tools to help you figure out what to say and then how to say it in a way that's effective. But I also like to share this because there are a lot of great frameworks out there, and the one common thing across all of these frameworks is values. So no matter what strategy you look at, one of the things that is always lifted up is that we have to think about what people value and appeal to those values as we create messages. So some of those examples are public health reaching across sectors at the Beaumont Foundation. Berkeley Media Studies Group does media advocacy work. Robert Wood Johnson Foundation earlier this year released a report on structural racism in health messaging. I don't know if they've actually made that public yet. The last time I checked, which was probably a few weeks ago, it was not yet live, but it's great whenever it comes out. They did do like a web release, and we're just waiting for them to publish it. The Government Alliance on Race and Equity has the Affirm Counter Transform model. And one of my favorite resources, if you've not used it, especially around racial health equity, is Voices for Healthy Kids, which is an initiative of the American Heart Association. So what is moral foundations theory? This is adapted, all of this work is adapted from Jonathan Haidt's The Righteous Mind. And it really centers on the idea that we are driven by our intuition. And so this image of the elephant with the rider is like, most of our brain is the intuitive elephant. And so you hear me say that again, maybe later. And 10% of it is the driver, or the rational brain. So it's important to know that, because a lot of our response, how we talk to people, how we interact with people, is driven entirely by intuitive responses. And so if we can tap into our knowledge of that, it helps us to interact with people more effectively. And so part of Haidt's work is that we resonate as individuals differently to 6 moral foundational values. And actually, I'll talk about these, and I'll show you this group's profile. Honestly, I'll have to pop up a different screen. But There are six: care, liberty, and fairness, loyalty, authority, and sanctity. And very quickly, care is what you think it might be, which is compassion for the vulnerable, intolerance of suffering. Liberty, you can imagine, is about freedom. Fairness, about being treated fairly, about people getting what they deserve. This one's really interesting because there are variations between where you fall on the political spectrum in your perception of what constitutes fairness. So, on the left, that is about equality of outcome often, and on the right, it's more about getting what you deserve, even if the outcome is inequitable. And so those kind of nuances are important to understand, because when we say that's not fair or that is fair, we are not necessarily defining fair in the same way. And so understanding that helps us to connect with people who might be across the political aisle from us, and to understand where they're coming from. Loyalty, this is important, especially in public health, because this is about group identity, and it's something that we can appeal to when we think about health education and outreach. And then authority and subversion. So this is about the competitive advantage of organized groups, and authority, the appeal of authority figures, and intolerance for people who do not comply with the system. Yeah, thanks, Jen. Yeah, I think we all, you get in these conversations and you realize I'm not talking about fairness in the same way that you are, and it might take some time to get to that point. And then the last one is sanctity and degradation. And so this is really about, valuing the human spirit and concepts of, the purity of the body and aversion to personal degradation. So this one often comes up in the world of harm reduction. So part of the Haidt's work explores the two different kind of the liberal and the conservative moral matrix. So in the liberal moral matrix, people tend to resonate much higher with care, liberty, and fairness, and loyalty, authority, and sanctity are much lower. So the heavy emphasis on helping people in need, caring for people, preventing harm, rights and fairness, and wanting people to have equal outcomes. And then on the other side of that is the conservative moral matrix. So what's interesting about this work, and part of why we do this training, is that conservative people tend to resonate pretty equally across the board with all six. And so they do resonate with care, liberty, and fairness pretty high, but even a little bit higher on loyalty, authority, and sanctity. So they want to help people in need, but in the context of preserving institutions and norms. So when you think about messaging in the conservative context, it's like, what institution or norm or practice are they trying to preserve, especially in the policy arena? So often this comes into play when you think about closing businesses, for example. So the people that they want to, conservative might want to help that's in need is the business owner. And why? They want to preserve the economy. So just thinking about it in those kind of terms. And here's why that matters. Haidt calls this the conservative advantage, which is people who are more conservative have an easier time of actually talking about issues across the board with other people, because they naturally resonate with all six of these values. And that it's much more difficult for people on the liberal end of the spectrum because they don't have as high of a connection with these other three on the end. Well, our perspective in becoming better messengers is that, in fact, we do have a public health advantage. And that is, of course, it makes sense. Public health naturally resonates with care, liberty, and fairness. This is kind of the core of what we do. But we also like to call attention to the fact that, indeed, we actually do identify with loyalty, authority, and sanctity. Loyalty in the sense that community coalitions, community partnership is the core, heart of how we get public health done. Authority, public health is a police power. So our ability to order quarantine, food inspections, responding to disasters, we are authority figures. And then finally, there's sanctity, which is about the nobility of public health, that we are the people who will go in and we fight the fight. We fight for social justice. We address these really pressing issues because it's what we do in public health, and the sanctity of, and part of that's driven by our wanting to preserve the sanctity of human life and the sanctity of our communities. So I'm actually going to stop share. And before you answer that question, I'm going to show you the profile for people who were able to respond. And if you didn't get a chance to respond, not a problem. You can take that survey at any time and see what your profile is. But this is the aggregate profile for this group. So you see the N equal 15, and it says book chapter respondents because this link is associated with a dissertation research that was published. And so we use that link primarily to continue to collect data along with the researcher who wrote, our colleague who wrote her dissertation on this work. So as you can see, very high among the respondents among fairness, and care. This is like very, like all the public health groups we do, this is what it looks like. With very, little variation here and there. And then loyalty, authority, and sanctity, these are actually higher than some other groups. So sometimes we get these down to like 1.1 something, sometimes very low, depending on the group. And so it's interesting to know this because it's also, one of the things I think that's interesting, like Haidt in his video on YouTube, is he says, what kind of people go to TED Talks, right? The same kind of people. And so like the danger of groupthink in the sense that you're around people who think like you, and you got to get out of that environment, right? To have conversations that will move policy forward. So let me go back to the other presentation. And so if you took that, or you've heard me talk about the values a little bit. So in the chat, what MFT values, so care, liberty, fairness, loyalty, authority, or sanctity, do you believe is the most difficult for you to use in framing your public health messaging? I'll give you a moment to think about it. I'll share my answer. I have a hard time with sanctity. I think I might bring the average down on the data set. That is how low I scored on sanctity. So that was, I always try to be very attentive to that because it is very challenging for me to think of how to message. And so I see a few other sanctities in the chat. Authority, another sanctity. Loyalty has come up a couple times. Fairness. Fairness is hard, right? You think it might be default, but it's really hard because there's so much nuance around what is fair, as we were kind of noting. Loyalty and authority. Yeah, so loyalty, authority, lots of sanctities. And another fairness, yeah. So this is important because we have to know where our own weaknesses are, because our default is to talk about things in a way that's natural to us. So of course, I'm going to talk about how I care about my community. That's going to come across easy. I can probably make a really compelling case for why we should care about people and why we should care about, whatever the issue is. What's harder is when that's not as high for people and maybe sanctity is higher and you have to connect on that. And so being conscious of our own weaknesses in messaging so that we can be better messengers. So what I want to do is I mentioned our colleague. So this is Dr. Barbara Alvarez Martin. She is at UNC Lineberger Comprehensive Cancer Center at UNC Chapel Hill. And she did her dissertation research on this and actually got to work with Jonathan Haidt on testing some messages for different groups. And so what did she find? So this is from, the number is 500 and I think 521. The number is probably somewhere and I just can't see it, but you can see the total number there. So this is North Carolina public health officials and then non-public health officials. So elected officials who are not in health agencies. And what you can see is, and hers is ordered a little bit differently on the second half of the graph, but very high in care and fairness, which this group was as well. And then very similar patterns across loyalty, authority, sanctity, and liberty. And what you can see is that there isn't actually that much difference between public health and non-public health. So it tells us that we have things in common with people who are outside of the public health sector, even if we don't realize that. So she did a breakdown in several different parameters looking at the data in different ways. And so one of the ways that she looked at the data is by political view. And so this is the result by conservative, moderate, and liberal leaning folks. And so these were all statistically significant, except for these two boxes on care and loyalty with a caret above them. All the other differences were significant. So what does that tell us? It reinforces what we know about trends, which is People who are more liberal leaning, higher on care and fairness, and the opposite for conservative folks. And then you see the trend that we also know from research, which is conservative folks tend to be higher on all the other values than people who are liberal. And even loyalty looks pretty significantly different if you look at liberal versus conservative. And this data, there's the number 519. So Barb, our colleague, also looked at the data by age. And so a question for you in the chat is, what age group do you think resonated with most with the MFT values across the board? So all the values. What age group do you think resonated most with all of the values? 30s and under, 40s to 60s, over 70, no difference, or more than one group. So let's see what we've got. We've got over 70s, we've got a couple 40s to 60s, another couple over 70, 40 to 60, couple no differences, more OSA. So it looks like a split mostly between this over 70 and the 40s and 60s answers, maybe no differences in there. And if you said over 70, you were correct. So what she found is that over 70 is a dark blue bar here, and this group resonated with the values much higher than any other group on every single value. And then there's a little variation amongst the other age groups. And so what does that tell us? That one is to think about, especially as a lot of our elected officials and appointed officials tend to be older, right? And thinking about, as we get those generational differences, like what values appeal to those groups versus younger groups. And if you are a younger public health professional, thinking about where your blind spots are when you're talking to people. So the big takeaways from this are public health has more in common with other sectors than we realize. And so I think, especially, I say this a lot, I talk to a lot of other public health people. Most of my social network is people that I know from public health. And I was thinking about this the other day, the importance of making sure we have those connections with other sectors, and also realizing where we have commonalities. The big takeaway from becoming better messengers and values-based messaging is that it's important to speak to your audience's values. So we really want to understand things like education level and generational differences. I didn't talk about education, but the education spread looks very similar to the age group. So people with lower education levels tend to resonate more with like conservative profile on MFT values, and then higher education level, more liberal. These are things we already know from other research too, right? Values have different meaning for conservatives versus liberals. We talked about fairness as equality versus proportionality. There are nuances in the other ones as well. And then the big thing is, one time I was asked, well, what do you do if we don't have a budget or you don't have a comms person, right? Well, messages appealing to care and fairness appeal to everyone at a very high level. So if all else fails, use care and fairness as your default values that you're trying to, as you think about creating your message. So what we're going to do is I will stop share for a moment. Is think about what other words we associate with the MFT values. So for example, for care, you might say compassion, or for fairness, you might say equality. And what I will do is paste a Jamboard. And so I will set a short timer on my end if people can go into the Jamboard. And if you have any issues accessing it, let me know, but you'll see 3 slides in there. We're just going to look at the first 2. So I don't want to assume that people have been on Jamboard before. So if you haven't, on the left-hand side, there is a sticky note, 4 icons down. You can click on that. You can write anything you want on it and stick it wherever under any of the columns. So, so take a few moments. I will look at my timer and take some time to fill it out. I wish I didn't plan ahead to play music, and I'm not a singer, but imagine there's music playing. So there's first two slides. So you can spend some time on this first one. So care, liberty, and fairness are on this first Jamboard slide. And then loyalty, authority, and sanctity are on the next one. I love how many sticky notes are appearing, by the way. It's just like boom, 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 boom. It's great. Sometimes we do this as a word cloud and Mentimeter, which is also fun. But I like this because then you can see kind of the different takes that people have on words. I might move some around just so I can see all the words. All right, and if you're not yet on the second slide, go ahead and start to look and think about some terms there as well. These three might be more of a challenge for you to think of words, so spend a moment there. And I'll give about one more minute and then we'll talk about some of these answers. Okay, feel free to keep working on these. What I'm going to start with saying is, number one, why I do this exercise. People often struggle to think of, well, how do I come up with a message? Well, this is how you start. What are words that appeal to different values? Those are the words you want to use in your message. So if you're appealing to care and harm, or fairness and cheating, etc., you're going to pick words like the words that people have been populating here, and you're going to put them in your message somewhere. So that's number one. So I like people to think it's not as hard as it sounds sometimes. It's like, what words will make people think of a value? Let's use those and then tie them to our issue. So for care, we see a lot of love, protection, suffering, safety net, charity, person-centered. Whoever, if the person who put person-centered doesn't mind coming off mute, would you share why you put person-centered?
Yeah, that was me, Jen. So I put that because when I look at the definition of it, it just makes me think about people and how we connect with each other.
I like that. I haven't seen somebody put that yet. So that's, I was like, oh, that's really interesting. So along those lines, feel free to come off mute. Is there something on any of these words that somebody put a word that you were like, oh, I didn't think of that? or anything that's surprising about the list that's come up so far.
Can I actually lift up, I'm struggling actually with the fairness and cheating one, because I tend to think about fairness as equity as opposed to the lack thereof. And I just recognize that it's so dynamic. There's such a varied definition of what that means to people, and then across these conservative to liberal lines. It makes me think about, in the heart of the pandemic, a very conservative neighbor of mine, I live in a rural area, was on a walk and came over, and we were chatting a little bit, and we ended up getting into, like, I was on the news a lot, and they said, well, how do you decide what to say or what to do? And I said, well, I just try to do the right thing. And she said to me, well, how do you know what the right thing is? I have like thought about that over and over again for so long. So I'm just loving this webinar because I've never seen this framework, and I just really appreciate it.
Well, thank you. And honestly, that's why I love this, because I feel like people go through and they're like, I've never thought about it that way before. And before I joined the network, I hadn't either. This was new to me. And so I feel super blessed that I get to do this now. But yeah, I remember getting questions like that too. It's like, well, who gets to decide what's right? Or how is right defined? But what about other folks' responses or thoughts on the words that are coming up, or where you may be challenged?
Hi, this is Megan from Colorado. One of the things that came up, and when you were asking like which ones do we most resonate with, the authority piece, there's it's interesting to think about it in the context of like some conservatives are trying to undermine government and strive and like reduce government budgets. And so there's like I understand it from the like preserving small businesses, but also they're like attacking institutions, particularly in public health, and like undermining the authority of that. So it's sort of like the complexity of messaging in that when you're trying to affirm public health authority at the same time that's being attacked. So I don't know if there's any advice in there that you can recommend.
Yeah, I would love to hear what other folks think, because I think that all of us probably are challenged with that in our communities. But one thing that I would say is I think we have to reframe when we say they're attacking authority, because from their perspective, they are not. When we say they're taking away our public health authority, they're like, no, in fact, we're preserving the institution of government, or we're preserving the power of the governor or the legislature or whatever. They're not thinking that they're taking away anybody's authority. I mean, they know that's what they're doing from a practical perspective, but we're talking about it in a very different way than they are. So first step is to think, how can I reframe my understanding of their argument? So if this is what I think, and I think public health authority is being stripped, how might someone else be talking about it, right? What about other folks on the call? Like, have you experienced that, and what are your thoughts on that?
I can talk just a little bit. I think for me, the authority, when I butt up against authority in conversations about what public health has the authority to do or not do, it feels like that authority argument really aligns with the liberty argument too. And it's almost the idea that, if America is a free society where we should be free to make our own choices, I, as the individual, should have the authority to make choices for my household, for myself, and that's where I get really stuck sometimes, because we saw that, come out during COVID, that I should have authority over my body. I am a sovereign person in and of myself, which is just, a offshoot of that sort of American individualism narrative. And that one's a really hard one for me to tease apart.
Yeah, and you remind me that one of the things that's important to do is also not to think about authority, say arguments around authority and over our own bodies being universal across issues. So for example, we see this in harm reduction, where it's like you have one of the arguments is you have the right to choose what you do to your body. We just, as providers, as practitioners, want to make sure you have a safe space to do whatever it is you choose to do, and that there's something there to help you, should things go wrong. But that argument doesn't necessarily appeal to people on the other side. And so thinking about, so that's the harm reduction world. I don't think you could take that same argument about being able to choose with my body to reproductive rights, for example. So I think understanding that that conversation is going to change depending on the issue that's being discussed is really important. So not assuming that just because someone says, I respect, the authority that you have over your own body, there's always a caveat that it's, depending on the topic. So not forgetting that piece of it, or you're just remembering that piece of it, I should say. Yeah, about unless you were a woman. So yeah, it seems like there's a disconnect. And I think it's easy for us to say, well, if you value life, you value all life. But that's not actually how people approach it. And it doesn't mean that they don't value life, across the board. It's just that they have different priorities across that spectrum. So I mentioned sanctity being difficult. Sanctity is one that's kind of traditionally low for all the groups that we work with that are in public health. So we see a lot of words, like a lot of Post-its on a lot of the other ones. And this one, a little, just slightly fewer, but the words that come up there: holiness, purity, value, morals, purity culture, religion. So people naturally gravitate toward religion, and absolutely that makes sense, especially because that drives a lot of US policy. And so it's important to think about that. Any other kind of reflections on this piece?
Dawn, don't want to put you on the spot, but we do have some states that are working with tribal nations and tribal governments and whatnot. Just curious if there's any different things we need to keep in mind, just based on what you know or what research is out there in thinking about these morals when it comes to tribes.
Yes, I would say the important thing is to think about what the kind of getting very familiar with the culture of the tribe that you're working with. So we have done this workshop with a tribal member in Minnesota, and she shared a framework of healing that was important to her tribe. And that's, of course, going to vary across tribes, but I think that's really valuable because first and foremost, that is what drives like that connection in those communities. And so I think that is kind of the number one thing. And then kind of how do you relate that to what we understand about what people value? Because I think the sense, and I think you get this in communities, what we have learned over the past few years is that communities that have that strong sense of social cohesion and shared culture have often a set of identified values that is specific to that group. And so it's important to know that. So I would say take the time to invest in those relationships and learn from the people in that group about what their values are. Does that help answer the question?
It does. Thank you.
Okay. So I'm going to go into the kind of second half of this. I did kind of want to make sure that we take a break if people need to take a break. So before we get into the next section would be good, but if people are comfortable going, we can go and take a break a little bit later. How do people feel? Good to keep going? Thumbs up. Okay. So let me go back to sharing my screen. All right. Okay. So when I joined the network in 2020, I joined right after the pandemic started, and this was one of the first projects that I got to be on. So before that, the Becoming Better Messengers the workshops were really focused on what you just heard, the first half. Since I joined, we've added this piece on equitable messaging strategies and try to tie them, back into the MFT framework. So I have done some research looking at the different frameworks that I shared at the beginning and other communications research. And these are kind of the tips on how you create a foundation for equitable messaging. The first is to know your audience. I'll get into each of these in more detail. Second is to focus on places, systems, or conditions. You want to use asset-based framing, things you probably heard before. Use storytelling where possible, be authentic, and be aware of cognitive biases. That's actually probably my favorite part of getting to talk about this. So I'm going to start with know your audience. So this is, this is again tied to values. And this is research. I can update this, but there's some more recent research from another group that found basically the same thing. This is from the Opportunity Agenda. And that is that most people fall into this group of persuadables. And these are people who can be influenced. So when we think about messaging, a lot of times we think about the position of the opposition as what we want to respond to. COVID vaccines give people heart problems and kill people. And instead, we want to think about, well, what is the position of the people who are in the persuadable group? The important thing to note about that is that people who are in that group often hold views from both the base and the opposition. So that actually, to me, is an advantage, because that means you have a broader kind of base to work from for developing your message, but also to think about where you're putting your energy. Like, yes, you're going to message to your base because you want to keep them engaged. You're going to message to the opposition because you want to counter misinformation and disinformation. But when we're thinking about creating movements, especially from a social justice perspective, we're talking to the people that we can persuade to join the movement. So I like to share this one when we think about knowing your audience, and I share this all the time, and I still love it. And it's from Lee Drutman, and it says, it was on Twitter: if you are trying to make sense of Florida's vote to raise the minimum wage to $15 an hour and to re-elect Trump, I'd like to remind you of the upper left-hand quadrant of this chart I made back in 2017. Sorry if there's any background noise. Lots of voters are socially conservative and economically liberal. And so why do I like this? In the upper left quadrant, you see blue, red, and yellow mixed together. And so this minimum wage bill ballot initiative actually passed with broad support across these different political groups. But the reason I share that is because it's important to think about the messages that appeal to those groups. So the arguments for a high minimum wage are reduced reliance on public benefits, increasing consumer spending, fewer people in poverty, reducing wage disparities. But someone who feels very strongly about wage disparities is not necessarily the same person who believes that we're doing this because we don't want people to rely on public benefits. So it's important to understand that you can create a coalition of people with diverse views to build a movement. And when you reach out to them, you're going to appeal to them on the issue in a way that matters to them. So as people are going across the state of Florida talking to people about it, they were talking about what appealed to the particular voters that they were talking to. So I mentioned that I do racial health equity work. And one of the things that we, one of the questions we get all the time or comments, it's like, it's really hard to talk about this. So one of the questions for you in the chat is, which of the values do you think is most likely to come up in a discussion about racial equity? Care, liberty, fairness, loyalty, authority, or sanctity? The answers are fast and furious for this one, because nearly everyone is saying fairness. Fairness and liberty. Care. Yeah, so we do this, we ask this question pretty much all the time, and by far, the number one answer is fairness. But what I hope you take away from today is that when we talk about racial equity and we think about framing it around fairness, that we understand that nuance about how people define fairness in different ways. Care is another one that comes up, because it's like, if you care, right, if we care about Black moms dying at significantly higher rates, despite all these interventions, that's something that we can message to appeal to. And that can sometimes make it easier to find a way to connect. And then we saw, I think liberty was the other one that someone pasted. Let me just go back up really quickly. Yeah, liberty. And so for the person who put liberty, would you be willing to come off mute and say, oh, Travis, that was you. What were you thinking when you put liberty?
So I was thinking in terms, just because of the race aspect, and just folks thinking, freedom and the ability to do things that everyone else can do. Maybe some folks feel like not everyone can do that.
Yeah, thank you for sharing that. So I think that's a good illustration of look at where our brains went. Our brains went to fairness automatically. So think about, are there ways that we can talk about racial equity that appeals to any of the other values besides care and fairness? And then if we can, what are the ways that we want to connect that message, like Travis was just sharing? Authority and sanctity and loyalty. So the second tip is really related to focusing on systems, places, or conditions. This is because the intuitive elephant, our brain reinforces kind of things that we think to be true naturally, and also tends to reinforce things that are negative. That's just how our brains work. So when we lead with things that are focused on a disparity, we often reinforce existing perceptions people have about that population group. So one example that I typically share is instead, is African-American people in this community have more cases of COVID-19. We heard that a lot during COVID. But what we want to say, because what we want to do is focus on what can we change. COVID-19 is more common in communities that have a higher risk of asthma and COPD due to environmental hazards. The population that is most affected by those environmental hazards in our community is Black people, or whatever population group that might be. Same thing, you see this public health, people of color. I'm from New Mexico. People who are Native American may have higher rates of obesity and other chronic diseases. And I think one of the things is number one, what we heard a lot when I was in the department is, we don't want you to keep leading with this negative kind of statement about our community. And the second is, well, what can we talk about that is causing, higher rates of chronic disease among different populations? Because again, that's the thing that we can change. I like to share this example because, I'm personally very interested in the maternal mortality crisis. And of course, across the US, we're starting to see more of a trend toward thinking about really systems level policy solutions. But one way that you hear people talk about this issue is Black women die due to complications from childbirth at 2.9 times the rate of white women. And sometimes we make statements like that and we think you have to be impacted by the data, right? I think our default, I'm a data person. I might say something like this and think, aren't you just appalled by this number? The reality is not necessarily, because sometimes people say, well, what is it about Black women that they're dying? What can they control? Maybe they're not making good choices. We don't want to reinforce that. So when we think about messaging around that, we want to think about starting with, what do we want the world to look like? Black women have better birthing outcomes when there are policies in place that ensure that Black women are treated with respect and compassion, and that there are programs and supports to address and prevent risk factors for poor maternal health. Without these policies, Black women are dying at a rate that is 2.3 times the national average. This is just an example. The reason I share this is because we want to focus on the solution. We want to focus about the system that we can change, focus on the system that we can change. And then we want to tie it into, when we don't have those policies in place, what is the consequence? The other thing to think about is when it is and is not appropriate to compare to white people as a reference group. So I think, you might see literature and you see commentary on the idea that constantly using white people as a reference group reinforces this kind of narrative about, Black versus white. When we think about talking, sometimes it's useful to talk about it in the context just of that population. And of course, from an epidemiological perspective, sometimes you are talking about disparity ratios and you got to use the reference group. But I just want to put that out there, that you will see some commentary on let's not always make that the default discussion, white is good or white is the best, right? Then so what can that conversation look like if that's not what we're focusing on? And Travis, I see your hand up.
So in our clickbaity culture, the one sentence kind of headline, I think could be more impactful, or more, not impactful, but it could create conversation more than the longer sentence we should consider. Just wondering if what your advice would be on making sure we change the narrative, but also that it can be quickly and taken up by folks, especially public folks that are not into public health like we are.
Yeah, I have another training that I do that's a little bit longer on storytelling. And so we explore some of those things around dominant narrative. So one of the things, a good exercise, is to identify what is the dominant narrative and then what do we want the dominant narrative to be. So when we think about short and pithy statements, we might want to say something like, when you say Black mamas matter, That's one way to think, like, that's a short statement about what we value. Or Black women and infants deserve to be healthy or deserve to live. So thinking about focusing on that high level value, so you can come up with a short list of statements about, well, what is the narrative that we want people to believe in? Because that's ultimately what's going to drive a change in policy. So you can take like this longer sentence I have and say, well, what can we pull out of this sentence? Black women, Black mothers deserve respect and compassion from their providers. Then you could lead into people who are hooked into that might say, well, what is wrong with the provider-patient interaction and how can we fix that? So does that answer your question?
It does. Thank you. Okay.
Yeah, and I would say you're going to come up with a bunch of ideas. Like maybe what I just said is not a very clickbaity headline. I don't think it is now that, after I said it out loud, I was like, I don't know if I would click on that. But you're going to create options for yourself, right? Or your team is going to create options. And then you're going to go through those and say, well, what's most impactful? And then you're going to be ready with the follow-up information. And also in the chat, we have, reminds me of Your Brain on Drugs and similar shock value campaigns. Yeah. So thinking about those strategies, and people who like, this is their job, is to develop messages, is to take all of these kind of concepts and put them in that. How do we now create this targeted outreach campaign? And before I get on this, I see that I've heard there's a study, maybe North Carolina, that showed hospital interventions for Black women improved not just Black maternal outcomes, but improved outcomes for everyone, noting that US maternal outcomes are not great compared to other countries. I'm not sure of the study off the top of my head, but there is research that shows that in general, improvements that will reduce the Black-white mortality gap or improve Black infant mortality benefit all babies. That's a really important actually message when we talk about racial equity, is making sure that people understand the context of lifting up, for one group of people lifts up for all people. Like we are all rising together. So the infant mortality rate, if you design interventions that are really going to address the worst infant mortality rate, they're going to benefit all babies. So definitely think about how we make sure people see themselves in the group that benefits. Targeted universalism approaches. Yes, absolutely. So asset-based framing is, people, of course, you are very familiar with this probably, but this is about framing first with what we hope to see, strengths and aspirations, rather than deficits and challenges. So again, I think we often hear from communities we work with that we know have disparities is like, stop coming to us and talking about what's wrong with our community. We also have a lot of great things going on in our community. Let's talk about that. We do this largely because this helps us to overcome assumptions and perceptions driven by the intuitive elephant. Again, our brains are hardwired to believe the negative and to pursue negative thoughts. And so when we make those statements, we're just reinforcing what our brain is kind of already disposed to believing. One example I like to share is from this resource, Words Matter, Amplifying the Message Through an Asset-Based Approach by an organization called Step Up. So they were going through a process. They actually came up, again, this goes to the previous question, they came up with a list of alternative kind of ways to talk about what they do as an organization. I'm just sharing one of several that they generated, but they were kind of on the side of the left, which is Step Up seeks to reduce dropout rates and end the dropout crisis. That sounds like a laudable intervention, right? But also talking about things like a crisis has its own implications. So one of the alternative suggestions that they had is, at Step Up, girls find the time, space, and attention they need to realize their goal of graduating high school on time. That is the same problem statement, but framed in a way that focuses on the solution and the benefit. You go into a program thinking, this is going to help me to graduate. This is going to give me the time I need to be the best version of myself. That's a really great way to uplift people. Focusing on like going to a program where they're like, you're part of the dropout crisis may not lead to the same kind of outcomes. So just something to think about is like, how do we lead again with solutions and assets about the communities that we're talking about, the people we serve. So I've mentioned storytelling a couple times. There's this great training, I believe it's still available online, called What's Your Story? Creating Narrative to Support Public Health. It was a webinar that was done in February of last year. This is one quote from that, which is, storytelling is truth wrapped around a social experience. Great storytelling is being truthfully human. It's an honest expression of the human experience. Why do we do storytelling? Storytelling helps us make sense of the world. It influences our behavior. It increases our knowledge and awareness and shapes what we value and believe in. Storytelling is an important way to teach us skills. So when we think about outreach and education, and it builds connection. It emphasizes empathy and relationships. And it's importantly, very important, it cements things in our memory, and especially our emotional memory. So there's lots of research about when we have strong emotional connections to a story, we remember those stories, but we also remember the lessons from those stories more concretely when we have a strong emotional response. So why this matters? Again, the intuitive elephant drives what we think. So we want to use storytelling to appeal to people's values and beliefs. That people connect over shared experiences and values. So we want to be curious about what their experiences are and what their perspectives are. How do you think of fairness? Let's ask that question. Empathetic messages bridge divides. So bring in your data and facts after you've connected with people. I say this quote, and I don't remember who said it. People want to know that you care before they care what you know. That's really something important when we think about developing messages. It's like, have we developed that relationship with people? Do they even want to hear what we have to say? And then the messenger often is more important than the message itself, which is why we do this training. So that's also a bias. It's a natural cognitive bias that exists, is that we're often heavily influenced by who is giving us the message, especially an authority figure. That is more important sometimes than what is being said. So build trust and then think about how we enlist trusted partners and community members and messaging strategies. So I want to ask the group, and feel free to come off mute, and I'll give you a moment to think about this. But think about a good story you heard recently. It could be about anything. It doesn't even have to be long. The questions I have for you are, what was the story about? Why do you think it was memorable? And were there any values in the story that stood out to you? So I'll give you a moment to think about it. And if you want, you can raise your hand or come off mute, and I can stop share so we can see each other for this question. I will share a story with you. I saw the Barbie movie recently. How many folks saw the Barbie movie? Yeah. So why was it impactful? One, yes. So I loved it. It was impactful, one, because the experience of going with a group of my women friends. It was memorable to me because I thought it was really interesting, actually, this world towards the end, where it was still like women seem to be kind of in control, and yet kind of exploring this dynamic of men, like what their role is. And I felt like that in some ways was unresolved. I guess I thought the resolution was something that I was not expecting. I'll say it that way. And in terms of kind of narrative, what was my other question? Were there any values that came out of that? So for me, the values around that were about fairness, but also sanctity, because it's like, getting to choose your own life path, I think falls under the value of sanctity. So those were things that stood out to me. That's maybe an easy story because there were just, so many narratives explored in that movie. But does anyone have an idea or a story they want to share?
I feel like I'm doing a lot of talking, so I apologize for that. But I am on a school board, and the school board president is a storyteller through and through. I am not very good at telling stories. So for a graduation ceremony this year in May, for high school, he told a story about the origin of the color purple, as in the color, because the stoles that the highest academic achievement kids with highest academic achievement were wearing were purple, and folks were saying, why aren't they gold? And he told this story about how that color originated from like seashells or something, and how it was really difficult to get that color and how important that color is. So it was just really interesting how it connected to the context.
Great, thank you for sharing that. Somebody else have a story that came up recently that was memorable to you?
I can share one, actually. It's from a conversation I had just last night with my husband and my father, who's in town for the Minnesota State Fair, which is maybe not surprising if any of you are from Minnesota. It's a big deal. My dad, who was a boomer, white, educated, retired, was relaying a story. He was talking to his mail carrier who served in Iraq as a helicopter pilot and tried to get a job with a local health system to be a helicopter pilot. And the health system said no because he didn't have a diploma. And my dad came at it from my dad, the boomer, white, educated, came at it from a viewpoint of, well, the guy has the experience, he should be able to, he clearly has the qualifications, he should be able to do this. My husband is a veteran and went through education before he left the Navy and then got his degree afterwards, and came at it from a very different point of view of, he hears his fellow vets saying a lot that I have this experience, he feels like it comes from a sense of entitlement. And my husband was, taking a lot of umbrage with that, I guess, thinking about, well, but you should also have to work for it. And so it was this really interesting conflict of, maybe the idea of fairness, the idea of what is fair. And in these two areas, it was fair to my father to say, well, he has the experience, why can't they just let him do it? And it was fair to my husband to say that experience isn't enough. He should have to sort of work for it like other people did. It was a really interesting sort of conflict in terms of what defines fairness and what doesn't.
Yeah, that's an interesting story. And also, I think, raises another population group that we have to think about messaging differently, which is military. I grew up in the military. Both my parents were Air Force. My dad retired near an Air Force base, and the community that my family still lives in is very conservative and mostly military families. And then, of course, people who've lived in New Mexico for generations. So those dynamics definitely come into play when we think about messaging. And so that's a great story to share that concept. So let me go back to the slides. So I'm going to share this video. It's 3 minutes, so it's not long. And then I'm going to ask folks
My name is Brent.
questions afterwards. So you may have seen this. For context, this is a parent in the Missouri legislature talking about an anti-trans youth athlete bill.
In Boulware, and Chairman, I'll go as quickly as I can. I'm a lifelong Missourian. I'm a business lawyer. I'm a Christian. I'm the son of a Methodist minister. I'm a husband. I'm the father of 4 kids, 2 boys, 2 girls, including a wonderful and beautiful transgender daughter, who today happens to be her birthday. And I chose to be here. She doesn't know that. She thinks I'm at work. One thing I often hear when transgender issues are discussed is, I don't get it. I don't understand. And I would expect some of you to have said that and feel the same way. I didn't get it either. For years, I didn't get it. For years, I would not let my daughter wear girl clothes. I did not let her play with girl toys. I forced my daughter to wear boy clothes and get short haircuts, play on boy sports teams. Why did I do this? To protect my child. I did not want my daughter or her siblings to get teased. And truth be told, I did it to protect myself as well. I wanted to avoid those inevitable questions as to why my child did not look and act like a boy. My child was miserable. I cannot overstate that. She was absolutely miserable, especially at school. No confidence, no friends, no laughter. I honestly say this, I had a child who did not smile. We did that for years. We did that against the advice of teachers, therapists, and other experts. I remember the day everything changed for me. I'd gotten home from work, and my daughter and her brother were in the front lawn. And my daughter had sneaked on one of her older sister's play dresses. And they wanted to go across the street and play with the neighbor's kids. It was time for dinner. I said, come in. She asked, can she go across the street? I said, no. She asked me if she went inside and put on boy clothes, could she then go across the street and play? And it's then that it hit me that my daughter was equating being good with being someone else. I was teaching her to deny who she is. As a parent, the one thing we cannot do, the one thing, is silence our child's spirit. And so on that day, my wife and I stopped silencing our child's spirit. The moment we allowed my daughter to be who she is, to grow her hair, to wear the clothes she wanted to wear, she was a different child. And I mean, it was immediate. It was a total transformation. I now have a confident, a smiling, a happy daughter. She plays on a girls' volleyball team. She has friendships. She's a kid. I came here today as a parent to share my story. I need you to understand that this language, if it becomes law, will have real effects on real people. It will affect my daughter. It will mean she cannot play on the girls' volleyball team or dance squad or tennis team. I ask you, please don't take that away from my daughter or the countless others like her who are out there. Let them have their childhoods. Let them be who they are. I ask you to vote against this legislation.
Okay. So the question for you all, you can use the chat or you can come off mute if you'd like to talk about it, is what values do you think came out of this testimony and what we're being appealed to in this testimony? Care, fairness, care and fairness. Liberty, yes. For those folks who are putting answers, if you want to share what made you think care or made you think liberty, please share that in the chat or come off mute and you can say that way as well. Sanctity of a child's happiness, yes. Sanctity to being a parent or child. Sanctity for me is strongest when he's like not silencing my child's spirit. So for those folks who are like, I don't know how to talk about sanctity, this is to me one of the best examples I've seen. Appealing to the care that parents have for their children. Yep. I haven't seen anyone put authority yet. What do you think authority-wise is being appealed to?
I think it comes out authority on all levels. So the child's authority of themselves, the parent's authority over the child, and then the appeal that government should not have so much authority in their lives.
Yes. Yeah, absolutely. All of those things come into play. So authority is, multi-layered and complex as we know all things are. And so, yes, we're saying, one of the arguments is I have the authority to decide what is best for my child. And I should have that right. The other argument is you lawmakers are in a position to make a decision that will affect people's lives. Make the choice, make this particular choice. And the authority of the child to decide how to express themselves. So all of these things also come into play. And in the comments we have, I heard authority and let children have their childhood. Yep, that definitely appeals to authority. Agree with Travis. Real question, where does fear come in? Well, this is a good question. Where do you think fear comes in?
I guess the reason that I asked the question is because I heard him say in his testimony, the reason that he didn't let his daughter dress in girl clothes was because he's afraid of her being teased, right? And I think that, I think we know that people in groups, when they're afraid of something, when they're afraid of change, when they're afraid of loss, when they're afraid of their kids getting teased, all of us start sort of doing things that are very unpredictable, that are really, maybe we wouldn't normally do if we weren't afraid. I'm a little stuck sometimes. It's how do you get past those people's fear of the other, fear of loss, fear of change, fear of someone undermining what they perceive to be sanctity in their definition, or fear of losing power. I think I hear this a lot when we talk about, we talk about reparations in my church. What does it look like to give reparations? And what is our obligation as Christians to do that? Sorry to bring church into a government space, but I think people hear the word reparations and they get afraid something's being taken away from me. I'm not going to do that because I'm going to lose what I have that I worked hard for, which is obviously, the fairness part of things. But fear makes people in group do funny things. So what do we do?
Yeah. I want to first say, I don't think I appreciate you apologizing for bringing church into it, but I actually think it's great that you did, because we bring every aspect of our identity into everything that we do. And your relationship with church, or anyone's relationship with any group, naturally informs the way that we interact with people and think about the world. So I think it's important that we're able to talk about that and acknowledge that. Fear, I would love to look into more research on this. Let me start by saying, I don't know all the research on that. I will say that I think fear comes in any of these values. So when I think about these emotions of like fear and joy, excitement, things like that, those can show up with any of the values. So it's important to name the fear and have people identify and name it, right? That's step one. And then step two would be, what do you think the consequences are if your worst case scenario is realized, right? What do you think is going to happen? Let's talk about that and get that on the table. So half the battle is naming it and talking about what that could look like. And then solutions oriented, identify, well, what can it look like if things go right or go well or whatever. And so those are some ways to think about how we approach when people are afraid of change, or when people are afraid of a policy and the consequences is like, let's talk about what you're afraid of happening. And you may not still get to a point where you come to agreement, but it's important to have those conversations. And then I will look at this one last comment and then we will move on. Appreciated the way he opens. Many people have questions, don't understand that he acknowledged that he was that way too. Yes, that's important. And the general framing was, if you get to know transgender people directly, you may change your mind to connecting with fear of the unknown. And he showed his own vulnerability. Yes, that is how we connect with people, is that we share our own experiences and are vulnerable in how we do that. So we've talked about dominant narratives. I do want to I'm actually close to the end. I do want to take a moment to do this quick exercise. The last slide on the Jamboard, so if you have the Jamboard open still, is messaging and dominant narratives. So you can look at the slide, and right now it says the slide 3, what are some dominant narratives in public health? We'll take maybe 2 minutes here, but what is a dominant narrative? This is from an article that's cited at the bottom there. Dominant narratives are those stories we tell ourselves, learn, or share with others, whether consciously or unconsciously, that also uphold existing power dynamics. So I asked this question because the video we just watched is an example of that, which is we have to maintain traditional gender norms because that's the safe thing to do, or that's the appropriate thing to do, or our religion demands that. So what are some of those narratives that we encounter in public health? This may be harder for people to think about. The idea here is just to see, just to brainstorm. What do you think are some dominant narratives that we encounter? And I'll watch the clock. So it's 1:43, we'll go to 1:46. And if you want to use the Jamboard to paste ideas. Public health are killjoys. Yeah, did I put that on I did. Or I didn't. I said public health is hard to define, but I do think there's this big narrative right now of what is public health even? Yeah. That the professionals know best. That actually is a great dominant narrative. And it's one that you see because of social media and the culture around this rapid sharing of information that we can't always verify, is that people are not trusting in professionals in the way they used to in the past. And how do we leverage that change in the way people communicate? We're not doing a great job of it. So what can we learn about how people communicate now and make changes? Greatest good for the greatest number. And that's important because that's a core kind of principle in public health, but one that not necessarily is accepted, especially in communities where public health authority is threatened or has been undermined. People are tired of hearing about public health. Yep, that's a dominant narrative right now. Let's see. We are taking away freedom and rights. Public health aren't doctors, so they're not experts. Yes, that's a good one, and one that we have to constantly challenge. make better choices, or they didn't make good choices. Yes, thank you to whoever put that. That is great, because I think it, goes back to, we want to focus on systems level change and systems level solutions. So when we talk about these dominant narratives, we don't want to get into a debate about whether people made good choices about their health. We want to say the system created choices for people or took away choices for people, and that is what resulting in the health outcomes that we see. Public health services are for the poor. Yeah, so a messaging strategy would be around, what are all the amazing things that public health does? There are some health departments that have really great messaging campaigns about this is public health, and like what it looks like in your specific community. So it's like safe swimming pools and restaurants with A grades and whatever that might be. Bootstraps mentality when it comes to health, and so kind of coming up against that. These are all really great, and I will make sure that these are sent to you. If you can't download them, I will make sure that they're sent to you so you have these as well. The reason we want to do this is because we want to think about, when we're thinking about messages, is, are we playing into the dominant narrative, number one, and then how do we counter it, number two. So we often reinforce a lot of these narratives with the way that we talk. And we don't, and if we have a negative reaction to it, like public health are killjoys, for example, how can we talk about ourselves in a way that makes us seem that we're not that way? So moving on, a couple of quick other storytelling. I will actually just talk about this one. This is from where's the other one? Humans of New York. If you don't follow, great stories. If you just want stories that make you feel something, and this is good. But I'm going to tell you very quickly about this one, which is ER. There was a study done about an episode related to HPV and cervical cancer. And of course, they assessed knowledge before and after the episode, and then 6 weeks later. And what they found basically is that people remembered learning about HPV and cervical cancer. They had a high retention 1 week after the episode, and still pretty high retention 6 weeks later. And most people said it was because of that ER episode that they even knew about it. So this is about the power of media. There's a lot of research on media and how they shape dominant narratives about health. I think this is really impactful because it's like storytelling helps to reinforce what it is. It's been used, Grey's Anatomy does it now, so I'm aging myself by using the ER example, I guess. But, Grey's Anatomy does it now too. It's like with messaging about vaccines and about birthing options and all kinds of other things that help to reinforce a narrative. So being authentic, thinking about using language that's meaningful to your audience, but also meaningful to you. So talking in the way you normally talk to people, engaging trusted community partners to deliver messages, making sure that we're using translators and interpreters. And of course, from a law and policy perspective, if our agencies are receiving federal funds, we are required to be doing these things. And then making sure we're centering the voices of impacted community members when we think about identifying solutions and trying to get people to understand and get involved in a cause. So on the right are a couple of examples from COVID, the conversation between us about us, which was Black healthcare providers, and the campaign on the bottom from Salute America. So this is my favorite thing, and this is kind of at the end, which is cognitive biases. I like to share these because they all are relevant for public health. This is from the Visual Capitalist. If you want to get into a fun dive, it's 50 cognitive biases in the modern world. It's a great resource. I like to share these ones because they're specifically relevant to us. But confirmation bias, which is that we remember information, again, that confirms what we perceive, and that intuitive elephant. So this is like people who believe evidence that COVID death counts were inflated are going to naturally gravitate toward research on the internet that proves that. In-group favoritism, this is something we can leverage so that we favor people who are in our in-group as opposed to our out-group. So that could be sports fans, that could be your church, that could be your neighborhood association, any of those things. So when we think about health education and outreach, we absolutely want to appeal to what groups people belong to. So a step in your stakeholder management process or partner management process is, what groups are we interacting with and what do they value? Framing effect, which is we can draw different conclusions on the same information depending on how it's presented. So a very well-known example is, there's research on this, a package of beef that is labeled 80% lean and a package that's labeled 20% fat. people will buy the 80% lean more than they'll buy the one that says 20% fat. Same meat, right? And then the last one, authority bias, which is a very well-known example, using doctors to recommend products and marketing campaigns like toothpaste and tobacco, because we are influenced by authority figures, and we have to take on that responsibility in public health as leaders. One of the challenges is that because we are in a position of authority, thinking about how that influences behavior and whether or not we're really, conscious of the outcomes of that. But also using our authority to influence group behavior, and think about how we can leverage that, whether our own authority or the authority of leaders in those groups. These are just some questions to ask. I'm not going to go through them all. What I will say is in-group favoritism, one of the things I like to share is I'm in Florida during the pandemic. The governor came to do a roundtable with brewery owners and talk about the impact on businesses. There's a lot of craft breweries here. All of the panelists were white men. In the meantime, in my city, we have lots of breweries owned by women and people of color. And so now the reason I say this is, like, when you're aware of bias, then you naturally interrogate it. So you look at those panels and you say, are there women here? Are there people of color? Was this event accessible? Who is it appealing to? Why should I listen to this? Are these authority figures or not? So you're being aware of them helps us to consciously interrogate the situation and maybe make changes. The last thing I'm going to say is thinking about groupthink, because this is very important, especially we saw this during COVID. The example often is like, so we want to conform with our groups, and we will make really terrible decisions in order to preserve group harmony. A common example is college students who agree to be hazed in order to join a fraternity. In COVID, what that is not getting vaccinated by political party, right? We saw significant differences in vaccination rates. Because you very much resonate with a group identity, and you don't want to do something that's contrary to that, because you don't want to be seen as not doing what the group is expecting. There are ways to overcome that. One is that we're all in this together. So emphasizing the common good, having a shared identity, ensuring that whoever's a spokesperson for your group is someone that people actually identify with, avoiding language that evokes competition within the group, and then identify alternative solutions that appeal to this new shared group identity. So this is I have 2 slides, and then I have time for questions. Here are the big takeaways. Remember that we have more in common, again, with other sectors. Know your audience and speak to their values. Remember, values have different meaning depending on who you're talking to. And if all else fails, care and fairness have very broad appeal across all political opinions. And then from an equity perspective, making sure that the first thing you do is build relationships. We want to focus on what we can change about the systems rather than people or individual behavior. And we want to use asset-based language and lift up what works in communities. We want to focus on community and systems level solutions and helping people realize, importantly, the value of the solution and their role in achieving it. Sometimes I've used a slide in the past that said, what's in it for me? That's the question that people want to know. Why should I do this thing that you're asking me to do? And then again, trusted messengers. So this is just an information slide. I'm a co-founder of this group, the Collaborative for Anti-Racism and Equity. That's our website, herenow.org. These are all the organizational partners, many of whom you work with in health departments. We have come together to work on advancing anti-racism in public health practice. We just had our first webinar with Dr. Kamara Jones and other experts talking about, in part, APHA's Healing Through Policy Initiative, and the Praxis Project and BMSG, Berkeley Media Studies Group, just did a really interesting assessment of the way that racial equity and racism declarations were talked about in the media over the past few years. Excellent resource. You can check out that webinar, check out our website. And thank you. So let me stop. I know it's not a lot for general questions, but we have about 6 minutes, and I want to say it is important to us to know what you think about this. We actually go back through all these and we make tweaks based on evaluation. So please fill out this as a Google form. It's 6 questions. It's just 3 pick a button and 3 open text, but let us know what you think. I will make sure that you get the Jamboard, and yeah, questions or comments.
Dawn, I'm wondering if folks can complete the survey. Like, is that something we can share as part of that study, or is it only like, how is that available? Or do you have to buy the book for the code, or what's the best way there?
Nope, that email that you got with that link can be shared with anyone. We are actually in the process of updating our website, and any day now it will be up, and then people can just go directly to our website and click on the link and take it. But the one that you got is open to anyone to take. Then what we do is, if we know we're sending it to a group, so like for your group, we look at specific dates because we don't have any identity, like we have no way of identifying who took it. So we just look by the dates from the time that we advertised it to the time that we close it, and that's how we get the numbers. So for your group, I actually only pulled 8-1 to today to make sure that I wasn't accidentally pulling. We had another group from a university that used it recently. So at any rate, anyone can use the link that was sent to you. And thank you. Thank you for the comments in the chat as well. I haven't seen New Amsterdam. That's a medical show, right?
Yeah, I don't think it's on anymore, but what I loved about that show is that the main doctor would always ask, how can I help? And it was just such a different perspective on the medical system, I thought, than we typically see or hear about.
Oh, I like that. Oh, thank you, Jen. Yeah, I really do hope that you can take even one thing away from today and be like, I can do this, but at home, in your community, with your family. My family, half of my family is like very conservative and lives in the Midwest. And then half's kind of a little bit more progressive. It's really interesting. Family dinners are always fun.
We have a group of county commissioners from all across the state that meet here in Minnesota on a quarterly basis and advise our health commissioner. And so as you can imagine, you know, urban, rural, liberal, conservative. I hope I'm not saying too much. We had, you know, in a past meeting, someone asked our commissioner why she wasn't promoting ivermectin. I mean, it's a very wide range, right, of commissioners. And I think this sort of work can really help us all have a good dialogue in that space about thinking about the values that we all share. We've done some initial work in that area in the past. And I think that's really, I see that as the way that this group that's very, very ideologically diverse can move forward together as a group to advocate for public health.
For sure. You remind me, so it's a little bit of a tangent, but somewhat related, is there was an article about Indiana recently and how they increased public health funding. And it's funny because I was doing an interview and I was like, you know, I'm in public health. I don't think of Indiana as being like a model public health state. And I was like, no knock to Indiana. They do some things well. But I thought it was really interesting because they were really intentional about focusing on the way they messaged the needs for public health infrastructure and were able to successfully get it into the budget. It doesn't mean it wasn't contentious and that there weren't dissenters, but they did manage to make it work.
It's all about that messaging. We are actually doing some message research here in Minnesota, which, I mean, I think everybody sort of knows how Minnesota went in the last legislative session, where like there was just funding everywhere, right? And public health managed to secure some as well. And we know that as we move forward and we're looking for that flexible, sustainable, infrastructure-based funding, we got to really do some research on what will help people in other sectors become advocates and allies and accomplices for public health and health equity, especially.
Yes. So the last thing I'll say on that point is, at the network, we did a report at the end of last year called Fighting for Public Health. We're in the process of kind of next steps on that. And it really focuses on 6 steps for how we build a stronger advocacy campaign for public health. One of those things is we have to have champions for public health in other sectors. And, you know, love to talk about that more, but I just want to share that as a resource. That's something that is, take a look at that. We're currently planning for phase 2 to kind of how we actually put those opportunities into action.
Well, we are at time. I want to thank you, Dawn, for taking the time and providing such a wonderful presentation to our 21C folks. You did such a great job, and I know we at FAB are going to walk away with many things that we can do to help our messaging as well. But I want to let folks on the call know this is being recorded, so we'll share the link out in a follow-up email. We'll also share Dawn's evaluation link, and then we'll have a short evaluation for FAB as well. Just some standard questions that we do with all our programming. But otherwise, thank you all for joining and participating, and we'll follow up soon and hope you enjoy the rest of your day. And Dawn, hopefully the storm has passed you fully now.
Yes, right in time for the end of the webinar. But thank you so much for the opportunity to be here. It was great to be with everyone in the space today.